Hi, I'm Sandra. I will be the surgeon.
My name is Josh, and I am the first assistant.
Go ahead.
I'm Cassandra. I will be the circulator today. My position is unsterile. I will be assisting the surge tech with whatever that she needs in the field that she cannot reach or have access to. This position is important because by me being non-sterile and the surge tech is sterile, I will be able to rotate throughout the room the part that is unsterile to be able to assist her with the things that she's asking for.
Cynthia, I'll be the surgical tech. Pre-operatively, I will be setting up for the surgery, maintaining the sterile field, making sure there's no contaminations, and then I will orient the sterile field to the patient, making sure it's away from traffic, and then intraoperatively I'll be passing instruments and maintaining the sterile field. Before we start the surgery, I'll want to do a count, and then after the surgery, before the surgeon makes the closure of the patient, I'll make sure I do another count, and then that's pretty much it.
Hi, I'm Kashara, and I am the anesthesiologist. And today we will be doing a total abdominal hysterectomy. And my role in this is to maintain the patient's airway and breathing. And also I'll be injecting local anesthesia as needed.
Hi, I'm Ashley, and I'm the physician's assistant for today's total abdominal hysterectomy. During pre-op, I will take history and perform physicals and explain the procedure to the patient and ensure consents are signed. And then during setup, I'll help position the patient on the OR table, apply monitoring devices, and prep the surgical site. Intraoperatively, I will suction and sponge the surgical site, retract tissue for exposure, and control bleeding. And that's all I'll be doing today.
All right. I'm Cassandra, I'm the circulator, and I'm going to explain to you the direction of the traffic pattern for the OR. Once you come beyond these double doors, you have to make sure you have your PPE on. Come through these double doors, then we're going to walk through the OR. If you are not in a sterile gown or have on gloves, sterile gloves, do not go beyond the sterile field. You will wait or go around to where there is no sterile field, a non-sterile field. If you follow me, I will show you what is considered sterile. We have our back table, our Mayo stand, and our basin, which are all sterile. You cannot go in between sterile fields. So you have the patient that's draped. That's draped and it's sterile. You will not go in between, so that will be contamination if you go in between. So therefore the traffic pattern will be beyond those double doors, you're non-sterile. Behind here, from the double door sit right here where I'm standing will be considered semi-sterile. Beyond this point, back to the end of the Mayo stand will be sterile field, and it will be considered restricted.
Okay. I'm Kashara, I'm the anesthesiologist. I have to evaluate the patient and the patient's allergies, discuss the anesthesia options and potential risks with the patient. I will also administrate general anesthesia, and during the surgery, I will manage the patient's airway and breathing.
Medical technologist, and we have our back table and our basin and Mayo stand. This is where I set up everything before the surgery, making sure it's away from all other traffic, and I'm facing it. I don't have my back towards it. I'm making sure no one goes in this area, and it's away from the wall and all the other traffic in the way.
Hi, hello, I'm Sandra. I'm gonna explain what the scrub does to prepare, well, to move this to the patient. I'm gonna grab my basin, move it over here. I'm gonna set up the bully tip first. I'm gonna grab some hemostats. I'm gonna set up the patient real quick. I'm gonna grab some other hemostats. I'm gonna set up the bully tip circulator. Can you please grab the tip of it? And connect it. And then from there, I'm gonna put the bully tip there. And put this here so it doesn't get contaminated. Now we're gonna set up the suction for the patient. Circulator, can you please come with me? Please grab the tip only and connect it to the oxygen. I'm gonna grab the suction tip, the anchor suction tip. I'm gonna connect the tip to it here, and then we're gonna put it over here for the surgeon. And then we're gonna set up our light covers. Circulator, can you please bring the light towards me? And then that's how we set it up. And then after that, we're gonna move the Mayo table, the Mayo stand. I'm gonna bring it over here. Since the surgery's gonna happen in the abdomen, I'm gonna put it right here. I'm gonna lift it up. Here. Let me adjust it, not too high. And then I'm gonna bring the back table next to the Mayo stand. Here. And then I'm gonna bring my basin over here to block traffic. And that's it.
Alright, so today we are doing a total abdominal hysterectomy. I will be making a midline incision. We could also do a financial incision, but I will be doing a midline for more exposure and visibility for the surgeon. We will be also removing the uterus and the cervix. I will also be assisting the surgeon by retracting, suction, and closing the patient.
Time out. Today we're doing an abdominal hysterectomy. Our patient's name is John Smith. Our surgeon is Sandra, and there are no known allergies. Their birthday is 8/17/1945. Alright, nice. Okay, so then we're gonna do a midline session, so it's easier to remove the uterus and the cervix. Okay, can I have some retractors? Okay, can you please hold it? Local. Okay. Some forceps. We're gonna remove the cervix and the uterus. Have the knife. Okay, we're done. All right. There we go. There you go. All right, what's the tip? Can you please do it on? I'll give you the suture, please.